Welcome to this video on health economic evaluation. In this overview, we will explore the concept of economic evaluation in healthcare and introduce the four main types of economic evaluations. So, why do we need health economic evaluations? There are numerous effective health interventions and programs that can improve population health. However, limited resources prevent us from implementing all of them. We need to make difficult decisions to ensure that the available funds are used to achieve the maximum benefit. Health economic evaluation is a tool that assists in making these decisions by comparing the costs and outcomes of different health interventions. There are four main types of economic evaluations: cost minimization analysis, cost effectiveness analysis, cost utility analysis, and cost benefit analysis. These evaluations compare costs with outcomes but employ different approaches to do so. Let's start by looking at the different types of costs. Direct costs are directly associated with the intervention itself, such as the cost of medicines, equipment, salaries of healthcare staff, or transportation to healthcare facilities. These costs are the primary focus of most economic evaluations. Indirect costs, on the other hand, are related to the reduction in productivity resulting from the illness or its treatment. For instance, missed wages due to the inability to work. Intangible costs are subjective and difficult to quantify, encompassing aspects like pain, suffering, or grief caused by the illness or its treatment. Moving on to the types of economic evaluations, the first one is cost minimization analysis. This type is utilized when the outcomes of different interventions are the same, and the comparison is solely based on costs. For example, comparing blood pressure reducing medications made by different manufacturers with varying prices. Cost effectiveness analysis is employed when comparing interventions that have a common health outcome. This analysis examines the cost per unit of health outcome achieved, such as the cost per kilogram lost in a weight loss program. If interventions have different health outcomes, we use cost utility analysis. This approach employs a common outcome measure called the Quality Adjusted Life Year, QALY. QALY takes into account the number of extra years gained due to the intervention and multiplies it by the quality of life during those years. By assigning a value between 0 and 1 to the quality of life, we can compare interventions across different health conditions. The fourth type of economic evaluation is cost-benefit analysis. It measures both costs and outcomes in monetary terms. This analysis aims to account for all costs and benefits, including direct, indirect, and intangible, by assigning monetary values. Tools like the willingness to pay method or the human capital method can be employed to determine the value people attach to health outcomes or the monetary value of a person's life, respectively. Undertaking economic evaluations can be complex and may require statistical calculations and adjustments, such as stratification for different patient groups, discounting to account for costs and benefits occurring at different times, and sensitivity analysis to address uncertainties in the data. In summary, health economic evaluation is an important tool for decision-making in healthcare resource allocation. By comparing costs and outcomes, we can assess the value and efficiency of different interventions. Understanding the various types of economic evaluations allows us to make informed choices about the allocation of limited resources in healthcare.